Let's talk a bit about the risks of infant circumcision. Okay, so there's a risk of pain and bleeding and infection in infant circumcision, right? Okay, well, what is the risk of the loss of the foreskin during infant circumcision? Oh, it's 100%. It's 100%. It's inherent in the procedure. 100% of infant circumcisions result in the loss of the foreskin. 100% of infant circumcisions result in the ischemic necrosis, death of part of the penis. There is no way you can escape the fact that this is harmful. Part of a baby's penis dying of ischemic necrosis is harmful. There's no escaping it. If a blood clot lodges in my coronary artery and part of the cardiac muscle starts to die of ischemic necrosis, it's called a heart attack, and there is no debate about the fact that it is harmful. If a blood clot lodges in my lungs and I have an ischemic event in my lung, it's called a pulmonary embolism, and there's no debate over whether or not it's harmful. It's considered harmful. If a blood clot breaks off and goes to my brain, and part of my brain starts to die of ischemic necrosis, it's called a stroke, and it's considered harmful. There's no debate as to whether or not it is harmful. If the blood supply is interrupted to my intestines, in my bowels, it is called mesenteric ischemia, and it is considered harmful. Part of my bowel, your intestine starts to die. Of course it is considered harmful. There's no debate as to whether it's considered harmful. And yet, when the interruption of blood flow due to being cut off and thrown in a steel pan of an infant's foreskin, of part of his penis, when part of his penis starts to die of ischemic necrosis, when it's cut off, all of a sudden the harm of it is ignored. No, the harm of infant circumcision is inherent in the forced amputation. It is inherent in the death of part of a baby's penis. There should be no debate over this. Tell me what you think. Tell me in the comments. Infant circumcision is inherently harmful. You doctors are not going to escape the implications of this.